Hi, welcome to Is Your Thyroid Test Telling You the Whole Story? My name is Barbara Solomon. I'm a board certified nutrition specialist and a certified functional medicine practitioner. Before we get started, I need to go over this disclaimer. I am not a physician, and the following is intended for information only and not to be used to diagnose, treat, cure, or prevent any illness. This should not be considered medical advice and not a substitute for care by your licensed medical doctor. So let me ask you a question. Could this be you? Do you feel tired and sluggish? Do you feel cold all over, maybe just or even in just your hands and feet? Do you require excessive amounts of sleep to function? Do you gain weight really easily? Do you have difficult and frequent bowel movements? Are you depressed? Do you lack motivation? Are you kind of just mentally sluggish? Do you have morning headaches that wear off as the day progresses? Have you lost the outer third of your eyebrow? Do you have thinning hair on your scalp, face, or genitals, or maybe your hair is just falling out in huge amounts? Is your skin dry? Do you have brittle hair? Is it dry too? Do you have a swelling maybe around your face? Do you have muscle cramps even while at rest? Do you catch cold and other infections really easily and have a hard time recovering? Or does this sound more like you? Do you have difficulty gaining weight even with a large appetite? Are you nervous, emotional, can't work under pressure? Do you have inward trembling? Do you flush easily? Do you feel like your pulse is really fast even when you're resting? Do you have intolerance to high temperatures? Maybe you have diarrhea, heart palpitations, or insomnia? Do you have night sweats? Or maybe you're a little bit of both. Do you take thyroid medications and you found that you have to keep increasing the amount, or maybe you're just unresponsive to them altogether? Do you have TSH that tends to be high and then it tends to be low and modulate between the two? Are you sensitive to things like iodine? Do you feel worse when you eat gluten? Do you have a hard time digesting your proteins? Does coffee or chocolate make you feel worse? Or do things like echinacea and mushrooms make you feel worse? If any of these really summarize how you feel, you might be having issues with your thyroid. So let's talk about the thyroid. It is responsible for setting your basal metabolic rate. Basically, if you're cold, it heats you up. If you're sick, it amps up the immune system. If you're stressed, it calms you down. And every single cell in the body has a receptor site for thyroid hormones, which shows you just how important they really are. And because that's true, and because every cell is affected, you can have all kinds of symptoms that are thyroid based. So what can go wrong? Thyroid can affect lots of things around the body, like we just mentioned. It can affect blood sugar regulation. It can affect gut and liver and your hormones and the way that you digest your food. It can affect your blood cells. It can affect the cardiovascular system and bones and so on and so forth. So that's why you can have all kinds of symptoms. Today we're going to focus just on hypothyroid function, which tends to be the most common. And there's lots of different reasons why someone may have low thyroid function. Maybe you have problems with manufacturing the thyroid hormone or even utilizing it. Maybe you have problems with clearing the thyroid hormone. Maybe you have issues with autoimmunity, or maybe you have issues with pituitary that direct the production of thyroid hormone. Maybe you have problems with creating a thyroid hormone but not being able to convert it into something the body can use. And then maybe you have a problem with clearing those hormones. So you can see there's a lot of things that may cause you to have low thyroid function other than just, hey, I'm not making enough thyroid hormone. And the reason this is how this works is that all hormones work the same. And so as you can see from this pathway, you generate the hormone, you transport it to where it needs to go, you convert it into something the body can use, it gets sent to every cell once you have a nice converted activated hormone, and then you detoxify the rest. So if you have problems with thyroid hormone, it can happen in any one of these 5 pathways. So in order to determine if you have a problem and where that problem may be, we need to test. So what we do is we look for all of those 5 things we're talking about. We look for the ability of the body to be making correct amounts of thyroid hormone. We look at the body being able to move that thyroid hormone to where it needs to go to get converted and so on and so forth. So if your doctor is just focusing on your TSH, they're really just kind of looking at the feedback mechanism between your pituitary and your thyroid. If your pituitary thinks you have enough thyroid hormone, it says, hey, shut that down, we don't need any more. And if your pituitary feels like there's not enough thyroid hormone, it tells it, hey, thyroid, get off your butt and let's go ahead and make some more. So that's all you know is that, wow, the pituitary thinks I have enough, or the pituitary thinks I don't have enough. But if you can actually measure the amount being produced by the thyroid, which is looking at T4, and then the amount being sent to get converted to someplace else, and then the amount that's getting converted, and then the amount that's being sent to the cells, that is a really good indication of how your thyroid is working. Again, maybe the problem isn't in the thyroid. Maybe the problem is in autoimmunity, which I didn't mention, but is definitely one of the reasons for low thyroid production. And autoimmunity also needs to be tested by looking at various antibodies. In addition, the adrenal glands can have a really huge impact on thyroid hormone. And so we need to look at their impact too by looking at reverse T3. So this is why when you look at TSH and maybe looking at T4, which is the output of the thyroid hormone, you may not be able to find problems with conversions or thyroid binding globulins that send these hormones to the places it needs to go, getting rid of the excess hormones, whether or not your cells can actually use the stuff, or autoimmunity, and that's why you need to test. So let's spend some time in talking about autoimmunity, because it turns out that an autoimmune thyroid is not a problem with the thyroid, but it's a problem with the immune system. And when you have an autoimmune thyroid, things can go awry in various directions. Maybe your thyroid is slightly inflamed because your immune system says, whoa, something's going on here, and it needs to basically kind of attack it with autoimmune, depending on the type of autoimmunity. And so maybe the thyroid doesn't work so well and you have symptoms of having low thyroid hormones. Or maybe the opposite is true when you were just completely inflamed. Maybe you ate a bunch of gluten, or you got involved in iodine, or you had this infection that's just gone wild and it's really set off your immune system. If that's the case and you end up really destroying a lot of tissue in the thyroid, you can have symptoms of having hyperthyroid. So it tends to modulate between the two. Now, autoimmunity gets expressed for various reasons, but these are some of the risk factors of what may turn on an autoimmune thyroid. Things like low vitamin D levels, gluten intolerance, huge, as well as latex intolerance. Latex-containing foods being mangoes, papayas, guavas, kiwis, and so on and so forth, have been shown in the literature to really cause havoc for those with autoimmunity. Heavy metals, estrogen surges, pregnancy, infections, especially Yersinia. It turns out that that's one of the real big risk factors for having autoimmune thyroid. Insulin surges, stress, and excess iodine. These are the things that we feel can really upset the body and cause autoimmunity to get that activity to get initiated. Now, here's how the whole thing works. It kind of depends on what you're exposed to. So let's look at this monthly calendar from January to June and assume that your doctor's going to test you every month to see how your thyroid is. In the first month, they test your TSH and it's a little bit high, which means your pituitary doesn't think your thyroid's making enough thyroid hormone and it directs it to make more. And then maybe in February, you ended up eating a lot of gluten, and instead of being a slow thyroid, wow, your thyroid has gone hyper. And then in March, it's normal, and then in April, it becomes high again, and so on and so forth. And this is how you kind of look at autoimmunity. It modulates between a hypo and a hyper functionality depending on the type of risk factors that you're exposed to and how active your immune system is against the thyroid gland. So when we talk about having autoimmune thyroid, in addition to inflammation, there's also something called dominance. Now, I want you to look over here on the left side, and this is something called Th1. This is a type of immune system that we have. This is Th1, or the innate immune system, the immune system that we are born with. And up here on the top right is something called the Th2 immune system. And this is our acquired immune system. And these two things work together. If the body is seeing something that it sees for the first time, it uses our innate immune system and says, hey, I'll go ahead and take care of this. And if there's something that the body has already seen before, the Th2 system steps in and goes, hey, we've seen this before. You don't need to call out the big guns. I've got this thing covered. And it kind of acts like a seesaw depending on what the immune system it has to face with. So this goes up and down and up and down and up and down. Now, the problem with autoimmunity is that one of these types of immunities gets dominant, gets too strong, and it doesn't allow the other one to work so well. So it's important that you work with your practitioner to kind of figure out which dominancy that you have, because you don't want to keep doing things that will make the stronger one even stronger. You want to do things that'll make the weaker one a little bit stronger. In addition, what if you're sick? If you're sick, you don't want to rely on the weak side of your immune system to help you out. You want to look at the strong side of your immune system. So you want to go ahead and utilize the things that make that strong system even stronger. And then when you're not sick, back off on that. Another important component of this is the Th3 regulatory system right in the middle. So this would be the basis of our seesaw. And this is what's going to go ahead and say, hey, immune system, I need you to turn on. And hey, immune system, I need you to turn off, which doesn't happen so well with autoimmunity. And if that doesn't happen so well, we develop something called the Th17 inflammatory response. And this is when the immune system your body just starts to become completely dysregulated and you're full of inflammation. So you can see you really kind of need to be able to support the body in order to get the immune system to work effectively. Now, there's a couple reasons why someone may have autoimmunity. Maybe you have a genetic susceptibility, and then you have one of these risk factors, too much gluten, too much latex, an infection, low vitamin D levels, so on and so forth, and then your immune system starts to react. And once it starts to react and it generates inflammation, then you have loss of thyroid function. And at that time, your doctor looks at your TSH and maybe looks at your T4 and some of the other markers and goes, wow, you have thyroid, you have hypothyroidism, and normally they'll give you drugs. But again, in this case, we have to keep in mind it's usually not a problem with the thyroid. It's the problem with the immune system, and you need to support it from that basis. Now, in addition to having a genetic susceptibility, there's also autoimmunity that's infectious based, and we call this the infection model. And you could see here in the center is Hashimoto's thyroiditis and all the different types of things that may cause the immune system to become overactive and may allow it to start to attack the thyroid gland. And you can see there's lots and lots and lots of different types of infection that can turn this on. One of the other type of infections is something called cell wall deficient bacteria. And it turns out the immune system may be taking a bad rap in regards to autoimmunity. So instead of being overactive, it may just be trying to do its job by protecting us against stealth pathogens, such as these cell wall deficient bacteria. And these cell wall deficient bacteria live symbiotically with us. They are there to pick up and act as scavengers to get rid of toxins and recycle all the garbage left behind when cells are broken down or tissues are broken down. But the thing with these cell wall deficient bacteria is they need cholesterol so that they can survive, and they can't make it themselves. So they tend to take it from cholesterol-rich places like our brain or our muscles and our thyroid and our liver and our glands and joints, all the places we end up developing autoimmunity to. So these things, like I say, are symbiotic. But what if you're somebody that has an increased metabolic acidity? Maybe you're someone whose immune system is overly compromised. Maybe you have a bad diet, or you drink chlorinated water, or your mitochondria doesn't work very well and you don't have much energy. Maybe your gut is destroyed and you have too much bad bacteria. If that's the case, these cell wall deficient bacteria can enter the body through these mechanisms because of the weakened immune system, and that they'll cause them to overpopulate. Now there's other things too, like antibiotics or synthetic estrogens or statins that also can really just turn out to be cell wall deficient mycotoxins. So they're even adding more load to our body in terms of cell wall deficient bacteria. So we just want to be aware of cell wall deficient bacteria and go, hey, we need to pay attention to this. The instead of just going ahead then and just working on taking a drug in order to get the thyroid supported, we need to, from an autoimmune perspective, look at what we kind of talked about before, supporting the regulatory immune system, supporting the non-dominant side unless you're sick, and then support the dominant side, and then really looking to avoid these triggers, these bacteria and viruses and infections and those kinds of things in order to get the immune system to be calmed down. So how about those of you that are on thyroid hormones? When you are really hypothyroid, they may not be such a bad idea, and they may really help temporarily get you out of that mess. And unfortunately, if you've taken them for a long period of time, it may be so that the pituitary becomes so dysfunctional that it doesn't work so well anymore. It's like, hey, I try to control this thing, but I keep getting thyroid hormones regardless of what I do, and it kind of tends to shut down and maybe not work so well. So if you've taken them a long time, you might have to keep taking them. That's for you and your physician to decide. But we need the proper support. Research has shown that replacing T4 with T4 and T3 is a lot more effective. But some folks just don't do well with the natural T3 sources. So it's going to be a game to try to figure out which one works for you. Okay, so I want to show you from a functional perspective model how to find issues with your thyroid. And so we're going to look at a typical client that comes in to see me. This particular client is 31 years old. She's a female. She has dark circles around her eyes, peeling and weak fingernails, peeling soles of the feet, gas, anxiety. She's gained 10 pounds in 2 months. Doesn't sound like a thyroid, right? Just sounds like there's lots of things going on. You know, it's important to know she's on birth control pills. But she is really active. She exercises all the time. She eats an organic diet. She's a happy person. And she hasn't had any past medical issues. I mean, come on, she's 31 years old. She's just a kid. So here's some more things that are going on with her when we start to dig a little deeper. We find out about her eating habits. And we find out that, you know, she becomes energized after eating and she craves sweets in the afternoon, but her energy tends to drop. She's always hungry 2 hours after eating. I mean, she finds that she doesn't really process her food very well. She gets a lot of gas and bloating after belching after eating, and she is going to the bathroom all the time. She has a fuzzy tongue. She's very sensitive to things around her like smoke, and she has some food allergies, and she has mood swings, which is uncommon for her. And she's just all of a sudden started to develop acne and very, very tight muscles. So, you know, a plethora of things. So in order to find out what was going on, we went ahead and ran some labs. Now, I want to let you know we're going to look at this data from a functional perspective rather than a laboratory perspective. And the difference is with a functional perspective, we're trying to find dysfunction early before it has an opportunity to become a disease. That's what the laboratory ranges report as frank disease, in-out, high-low disease, and disease-free. Now, in this case, the doctor reported low vitamin D, which we know is a risk factor for autoimmune thyroid, and low T3 hormone, which means the amount of thyroid hormone that's getting converted is not quite adequate. Although the doctor in this case felt that low T3 was fine because the thyroid was doing its job in making T4 hormone levels that were normal. But you and I know that it's the converted thyroid hormone that makes a difference. It's the converted thyroid hormone that's, if it's low, is going to cause the symptoms. So we felt that that was fairly significant. So we found a lot of things functionally, but let's look at these things from a perspective based on thyroid. Now, first of all, lipid panel. She had a lot of problems with her blood lipids, and that can indicate potential inflammation because the thyroid can definitely interfere with that and glucose metabolism. We also found that in her GI panel that there was some issues going on. Basically, she had the start of hypochlorhydria potentially, which could affect cofactors as well as a potential gut infection that could affect thyroid conversion. Her adrenals were definitely involved, and this could cause problems with thyroid hormone conversion as well. She had problems with blood sugar regulation, and that also is an issue that can affect thyroid hormone conversion. She had low iron that might indicate an infection or inflammation, and she also had low calcium, which might be due to activity with low thyroid. She has oxidation issues, possible B12 loss due to the pill, and she possibly has some low hydrochloric acid due to the low thyroid function itself. Remember, the thyroid can affect things, and things can affect the thyroid just as easily. In terms of the thyroid itself, we definitely saw that we felt she was a T3 underconverter, and we also felt that she had, with her low T3 uptake, that there was an issue with estrogen, and that could affect the ability to move these thyroid hormones around effectively. We saw some dysfunction in her liver, which showed that she might have a problem clearing some of the excess hormones. So you can see there's a lot of dysfunction that's going on here that may have been directed and against the activity of the thyroid gland. So based on those findings, what do we do? First of all, we're going to ask if she would consider getting off the birth control pills, and if not, at least support their use. We want to look at the diet to help control blood sugar and help the adrenal glands, as well as remove inflammatory foods to take the load off the immune system. We want to look at detoxification for potential estrogen issues. We want to do the 4R protocol for the gut, and that would be removing things that are offensive to it, so infection or foods, replacing things the body needs, repairing it, and re-inoculating it. We want to do a good multivitamin, especially with vitamin A, not beta carotene, but vitamin A, essential fatty acids, and vitamin D. We want to provide a little bit of methylation support as well. And I want you to note that we are not directly supporting the thyroid. If there was an autoimmune case, we would go ahead and maybe provide a glandular to act as a decoy. But in this case, you could see we're not supporting the thyroid directly. What we're trying to support is thyroid hormone synthesis, thyroid hormone movement to the places it needs to go, thyroid hormone conversion, thyroid hormone utilization, and removal of excess thyroid hormones. So I want to just kind of go over a summary for you. First of all, the thyroid has receptors on all cells of the body, and therefore it can affect all kinds of function in the body, and all kinds of function in the body can then affect it. The common thyroid dysfunction usually occurs because of inflammation or autoimmunity, adrenal issues, gut issues, medication interactions, cofactor and nutrient deficiencies, or neurotransmitter imbalance, because the neurotransmitters turn out to start the whole entire process. You need to look at more than TSH to figure out where dysfunction is occurring. And we also need to recognize and respect that autoimmune thyroid origin is not the thyroid. So therefore, you need to test for your TPO and thyroid binding globulin antibodies. Many times you'll need to test multiple times. We come back a lot of false negatives. So if it doesn't affect my client's health in any big negative way, we'll go ahead and ask them to maybe expose themselves to some of the risk factors, like eat lots and lots of gluten several days before the test, and maybe try to turn on autoimmunity if we really feel it's important to have a true indication if there's autoimmunity or not. If not, and it's going to cause all kinds of symptoms, we just won't do that. So finally, we want to look at issues such as adrenals or yeast that can also mimic thyroid dysfunction. And many times, thyroid dysfunction can be really resolved with diet and just doing some very, very simple nutritional supplementation. Thank you for your time. I really appreciate it. If you'd like to find out more, you can check us out at functional medicine or functionalhealth4u.com, where we talk about functional medicine, clinical nutrition, and genetics. We also released our new book called Eliminating the Pain of the Elimination Diet. It's a functional medicine approach to diet and health-related issues, and we're going to go over a lot of that stuff that we talked about in great detail in the book. So thank you very much. Have a great day.